The pandemic has put a major strain on our healthcare system over the past year, but it's not just inside COVID units. The pandemic has greatly impacted the number of people seeking mental health treatment, although not everyone is getting the help that they need. Christina Laurie explains why.
The stigma surrounding mental health isn't new to the Black community. Dr. Martin Luther King Jr. reportedly had severe depression during periods of his life and refused psychiatric treatment even when his staff urged him to get help.
It's always been hard to live and be Black every day.
The root of mental health stigma among Black Americans can be traced back to the 1600s, when the first slaves arrived in America. At that time, some people thought the Black men and women they were using for forced labor weren't sophisticated enough to develop depression, anxiety, or other mental health disorders. That, of course, isn't true. Black Americans develop mental health conditions at a rate equal to anyone else. Still, they're less likely to ask for professional help, instead relying on each other.
We've got a great amount of history between having grandparents and sort of that neighborhood component or helping people survive.
But sometimes that's not enough. The stress of trying to survive a pandemic, coupled with the ongoing fight for racial justice, warrants professional help. Only 25% of Black Americans seek mental health care compared to 40% of whites.
That's been the biggest issue, is finding organizations and businesses that really believe in diversity, and they have it in terms of the people who they hire, how they train them, and how they provide the work.
Part of the problem is the lower number of Black doctors specializing in mental health.
It's something that we really strive to improve.
Dr. Beth Lonergan, the head of UW Health's Behavioral Health Unit, is working alongside the hospital's chief diversity officer to hire more Black physicians here in Madison.
It's difficult to recruit and well worth, the challenge, but it can be difficult. We do have some diversity, not as much as we need.
For now, Dr. Lonergan is working with the staff she has to get out into the community so people, especially Wisconsin's BIPOC population, aren't expected to come to her.
Now, 1 in 5 people, regardless of race, age, gender, or socioeconomic status, will experience mental illness in their lifetimes. And as we head into February, which is Black History Month, we want to help shed the stigma surrounding mental health treatment. So I've posted on our website, channel3000.com, local, confidential, easy to access mental health resources for you all to find.